I've just got off a Zoom presentation with Yoga Australia. It's always such a privilege to be able to share some insights around the midlife menopause transition to exercise practitioners. And one of the things that I was talking about was the incredible role of estrogen on skeletal muscle and also the outer part of the muscle, the myofascia. And we don't really understand that as we come through the menopause transition, this part of the body is also implicated in the decline of estrogen. Estrogen is known to be a critical part of allowing the muscles to stretch and elongate. It's called elasticity. So as we come through menopause, whether women are on HRT or not, if they're doing a lot of exercise, then they may experience a lot of painful joints, certainly muscle cramping or aches and pains that occur in their muscles, and this kind of dull ache or even restless leg syndrome at night, which keeps women awake. So as I explained to the practitioners, this is a really important role that they have to play in terms of allowing women to understand that because they're going through menopause, then there are adjustments that they need to make to their exercise. For too many of us, we go into the same exercise expectations that we've had for many, many years, and I was the same. I was used to doing a very high volume of exercise. I could tolerate a lot of intensity of exercise because I'd done it for years, but I didn't understand the changes to the skeletal muscle fiber and the fascial sheath as I came through my menopause transition. And what happens is that the ligaments and the tendons can become very dry. They can lose some elasticity. The muscles are also losing elasticity, but we also forget that the structures that support the muscles, the nerves and the blood vessels, are changing as well. With the nerves, they're starting to get a change in the myelin sheath around the outside, and in the blood vessels, we're getting changes to the inside of the blood vessels, and we're losing some elasticity within that inside of the blood vessels. And yes, hormone replacement therapy has a great role to play in allowing women to tolerate exercise, but I think a lot of women are also not understanding that they need to be changing some of the way that they exercise. Certainly yoga is really important. As I explained to the yoga practitioners, aerobic exercise is the key for reducing vascular stiffness or the stiffness of the blood vessels. So we must get aerobic exercise back into our life. And then, of course, we can have a really important factor is thinking about post-exercise. What are you doing after your workouts? And there's two of the foods that are helpful for reducing blood pressure after exercise and allowing the blood vessels to actually expand and dilate a bit more are the foods that have compounds called anthocyanins. So those are our purple foods, our blueberries, our blackberries, our blackcurrants, our beetroot. Those sorts of foods are really important to have after exercise. So I was able to share some of these insights with yoga instructors throughout Australia, and it was such a privilege to be able to help them understand that they play a really important role in helping women take into consideration some of the structural changes that are going on during their menopause transition. There's so much focus being given to the hormones, but it's about what those hormones do around the body. And hormones, particularly estrogen and progesterone, they have an important role to play in the function of skeletal muscle, and also the fact that we need these hormones to improve elasticity. But when we don't have those hormones doing their role, as happens in the menopause transition, Then we need to use our nutrition to help with that. We certainly need extra virgin olive oil. I'm always going on about that. We need beetroot. We need some of these purple foods. We need a healthy Mediterranean diet. And we also can be adjusting our exercise to compensate for the type of exercise that we need to be doing in as we come through menopause. And as I always say, exercise needs to be energizing, not exhausting. Yoga has a wonderful role to play. There's a lot of clinical evidence around how yoga can help reduce blood pressure. It can help reduce migraines, and most importantly to me, breathing type exercises. When you're doing slower breathing type exercises, then you're helping to expand the chest, because those tiny little intercostal muscles in your rib cage are also losing elasticity. So this is one of the reasons why women find that they're a bit more breathless, they're not breathing as well. So doing those exercises which open your chest and expand your rib cage and do your breathing is really, really helpful. I'm Dr. Wendy Sweet from My Menopause Transformation. I invite you to go onto my website, have a look at the programs I've got for you, do the symptoms quiz, listen to the masterclass on menopause, and of course sign up to the newsletter and just become part of this wonderful community, and make sure that you are learning as much as you can about this really important transition of our life. It's part of our life course, but we need to get on top of our symptoms. We need to get on top of our sore joints and restless leg syndrome, so that we can step into our healthy aging years beyond with the right physical function, with the right movement capability, and to also, feel a lot more energetic as well.